CNN's Omar Jimenez has more from Houston.
It was the public's last chance to say goodbye. Former Vice President and presumptive Democratic nominee Joe Biden visited with the Floyd family privately for over an hour, according to the family attorney.
I can't breathe.
It was 2 weeks ago to the day. This single cell phone video led to protests around the country and the world over more than just Floyd's death. Now, tomorrow is when we will see the funeral for George Floyd here. It is the final goodbye in what has been a series of goodbyes starting last week. But as you hear from protesters, as you hear from family and more, goodbye does not necessarily mean the end of George Floyd. In many ways, it is the beginning of a legacy we are seeing play out and pushes for long-term change. Floyd is set to be buried next to his mother.
Omar Jimenez reporting. Meanwhile, Democrats in the US Congress have rolled out sweeping legislation to overhaul policing. Speaker of the House Nancy Pelosi says a new bill would aim to demilitarize the police, improve training and ban chokeholds.
We cannot settle for anything less than transformative structural change, which is why the Justice in Policing Act will remove barriers to prosecuting police misconduct. It will demilitarize the police by limiting the transfer of military weaponry to state and local police departments. It will combat police brutality by requiring body and dashboard cameras, banning chokeholds, no-knock warrants in drug cases, and racial profiling.
However, the bill would have to pass the Republican-held Senate to become law. To the coronavirus pandemic now, and India is lifting restrictions, even though the number of new cases is still rising. In many parts of the country, restaurants, shopping centres and temples have been allowed to reopen. Here's the BBC's Yogita Lamai.
India is now among the top 5 countries in the world, ranked according to the number of COVID-19 cases. Hospitals in many of its cities are struggling to cope, and patients are dying before they can get treated. But the leaders of several states in India believe a phased reopening is necessary for the economy and that people have to learn to live with the virus. Masks are mandatory in public places, restaurants are only allowed to seat up to half their capacity, and in religious places, offerings of food, touching idols and sprinkling holy water is banned. Thermal screening is compulsory before people enter offices or shops.
Logita Lamai reporting. In Tanzania, the president has declared the country coronavirus-free, saying the disease has been eliminated thanks to God. But the World Health Organization has expressed concern over the government's strategy, and according to Johns Hopkins University, it still has 300 active cases. Our correspondent Daniel Kijo reports from Dar es Salaam.
President Magufuli said there are no more cases of COVID-19 in his country. He has urged people to keep working hard to build the economy. The Tanzanian government had stopped publishing data on the number of coronavirus cases in the country. On April 29th, the last official data was released. There were 509 cases with 21 deaths in Tanzania. However, President Magufuli said last week that only 4 patients were receiving treatment in Dar es Salaam, the country's largest city. Last month, Tanzania dismissed a U.S. embassy warning that hospitals in Dar es Salaam were overwhelmed and that the chances of contracting the virus were extremely high. President Magufuli has repeatedly said the health crisis was exaggerated and urged people to attend services in churches and mosques, saying that prayers would vanquish the disease.
Daniel Kijo with that report. China is digging in its latest diplomatic stoush with Australia. It's warned its citizens not to travel to Australia, which it calls a racist country. It's cited Australian media reports of racist attacks and humiliating treatment against Chinese nationals. Multiple government departments and state media have now amplified the message to the country's domestic audience. North Korea says it will cut a hotline communication link with South Korea over a dispute over a leaflet campaign by defectors from the north. The two states had set up a liaison office on the border in an attempt to reduce tensions. Kim Yo-jong, the North Korean leader's sister, threatened last week to close the office unless South Korea stopped defector groups from sending leaflets critical of the North. The two Koreas usually make phone calls twice a day through the office at 9 a.m. and 5 p.m. Yesterday, South Korean officials said a daily phone call to the liaison office in the north went unanswered. The scandal that's forced Prince Andrew to retreat from public life has taken another turn. The American Department of Justice has made a formal request to the British government asking that the Prince answer questions about his former friend, convicted sex offender Jeffrey Epstein. But Prince Andrew's lawyers have accused the US authorities of lying, maintaining he's offered to help US prosecutors at least 3 times. Here's the BBC's Johnny Diamond.
The language is cool and legal. The sentiment behind the words is angry and aggrieved. The Prince's legal team had been assured of confidentiality, they say. That was flouted. The Prince, they were told, was not and had never been a target of a criminal investigation. Now the US is trying to bring the Prince to a British court to testify, despite his 3 offers of cooperation this year. After the first of the offers had been made, the US Attorney for the Southern District of New York, Jeffrey S. Berman, gave a statement on the steps of Epstein's mansion.
Let me say that the Southern District of New York and the FBI have contacted Prince Andrew's attorneys and requested to interview Prince Andrew. And to date, Prince Andrew has provided 0 cooperation.
Inaccurate, said the Prince's lawyers. An outright lie, said one of those close to the legal team. In their statement, the lawyers ask whether the US Department of Justice seeks assistance or publicity. Up until this point, the Prince's legal team have remained silent, but they say the world has been entirely misled about the discussions over the Prince's cooperation.
Johnny Diamond with that report. In a statement, US prosecutors say Prince Andrew is trying to portray himself as eager and willing to cooperate, which they say he's not. Sweden never introduced a lockdown and has kept pubs, restaurants and shops open throughout the COVID-19 pandemic. The man in charge of the strategy later admitted that contributed to the country having more deaths than its Nordic neighbours. But it also seems to have boosted tourism, with growing numbers of European visitors breaking guidelines against non-essential travel in search of a beer or even a haircut. The BBC's Maddie Savage reports from Stockholm.
In Stockholm city centre, local passenger boats are busy with people heading off for scenic hikes or swims off the capital's rocky islands, although fewer people are allowed on board than usual to promote social distancing. Peter Albo is an able seaman on the services.
There's been a lot of foreign tourists for us. You are amazed to actually meet people that you know are from Germany or Spain or English also.
1 in 5 hotel rooms in Sweden were occupied at the end of May, the highest proportion in the Nordics. The majority of guests are Swedes, but some international travellers have been staying since the start of the crisis.
Hi, my name is Juana Marco. I'm from London. I've come to Stockholm on the 18th of March.
That's the day after the UK advised against all non-essential travel.
I have been exploring Stockholm, enjoying the restaurants or beauty treatments or visiting the other islands. Some say I'm lucky, some say I'm crazy. As a free spirit, that's what you do.
But people live in Sweden are still being advised not to take holidays abroad until at least the middle of July to avoid getting stranded as the pandemic continues. Peter Clark's a British expat who works as a barber in Stockholm.
Recently we've noticed a rise in the number of British tourists coming into the shop for haircuts. I guess it's a bit of a sucker punch really to know that I haven't been able to go back and see friends and family back home, and yet other people are kind of ignoring the rules and coming here. They could be infecting people while they're here, or they could be coming here and taking something home with them.
I put those concerns to Sweden's Foreign Minister, Ann Linde.
The most important thing is to keep social distancing. It's also to wash your hand and is not to stay too close when you are on a restaurant.
She says tourists are welcome as long as they follow the same guidelines. And officials are planning to step up advice for travellers as Europe's holiday season begins.
Maddie Savage with that report. And that's World Watch for today. Back to you, Tianiwa.
Thanks, Annabelle. And that's Midday Reports, Te Pūrongo o Te Pautūtanga for Tuesday, June the 9th. Stay with RNZ. We'll have the Ministry of Health's COVID-19 briefing shortly after 1. The Midday team will be back tomorrow. Kia pai tō rā. Coming up to the news at 1 now with Paul Brennan.
RNZ News at 1. Good afternoon. I'm Paul Brennan. The Director General of Health, Ashley Bloomfield, is about to give an update on COVID.
Well, kia ora koutou katoa. Welcome to today's stand-up. It is a beautiful day here in Wellington. I hope it is elsewhere in the country, and first day of Alert Level 1. I'm just looking around the room towards the back and want to acknowledge some of my colleagues who are here who have been part of the amazing effort put in by our Ministry of Health team, the health system team and the wider public service, but also I particularly want to shout out to my colleague, our National Director of Public Health, Dr. Caroline McElnay, who you will have seen at a number of these stand-ups. So, Caroline, thank you for your amazing work and that of your team and for the support you've provided to me over the last few months. So, today is our first day in Alert Level 1, and you will be pleased to know our numbers remain unchanged for the record, but I will run through them shortly. With the move to Alert Level 1, there are just a couple of important things I want to cover and address this afternoon. Foremost is for me is to stress the ongoing importance of very strict border arrangements and how this functions as essentially our safety net now that we are confident we have eliminated community transmission of the virus here in New Zealand. So with that as a priority, there are tighter measures and controls on people coming across the border into New Zealand, and these are designed, of course, to keep all New Zealanders safe from COVID-19 as we fully open up our domestic economy. As you know, people already entering New Zealand, and in particular those Kiwis returning home, do need to stay in either quarantine or managed isolation for a 14-day period when they enter the country. There are, of course, there is an opportunity for people to apply for exemptions for compassionate reasons, and that process does look at a number of exemptions, usually between 20 and 30 a day, requests for exemption. However, some of the additional measures we've put in place from today, everyone in managed isolation, as I have mentioned before, will be tested twice during that period, whether they have symptoms or not, around day 3 and around day 12 of their 14-day time in managed isolation. Anyone who is symptomatic as they come across the border is identified and goes into our quarantine facility and is tested anyway. However, that testing will be extended to everybody. This is part of our arrangements, of course, to ensure we are not missing anything at the border. But it will also allow us quite quickly to build up information about the likelihood of the risk that people coming through the border and linking that to where they have come from, whether or not they do have infection, either symptomatic or asymptomatic. And that will be directly informative of then what we might do at the border in future and what sort of arrangements we might have. Secondly, just to the exemption process, under Alert Level 2, there were 142 exemptions from managed isolation that were approved on compassionate grounds for people to attend funerals, tangihanga, or to visit a dying loved one. Now, as well as the 142 that were approved, there were 182 similar applications that were declined, usually where the applicants were not able to provide a workable plan for allowing an exemption to proceed safely. That changes from today. So from today, people in managed isolation will actually no longer be permitted to apply for exemptions to attend funerals and tangihanga. Let me go on. They will still be able to apply for compassionate leave to be with a small group of loved ones before or after a funeral or tangihanga, but not to attend the actual event. And I should say that people who have been in quarantine, that is, who have been symptomatic as they have come across the border, or who have developed symptoms during their 14-day isolation period and gone into the quarantine facility, those people have never been able to take up that compassionate leave exemption. We're making this change because someone who may have been exposed to COVID-19 overseas now poses a greater risk to those of us in New Zealand, given we are under alert level 1 with much greater interaction between people. And of course, those physical distancing requirements have come off, and likewise, there is no cap on the number of people who can be at these events. So there is still an opportunity for compassionate leave for a period to go and be with a dying loved one, or to grieve with other family members or friends, but just not to attend the actual funeral or tangihanga. This is, of course, unfortunate, but on balance, we think this is a necessary trade-off as we relax our domestic restrictions. We need to keep the balance of that increased in risk from loosening up our restrictions in alert level 1 with the potential for having to take a more restrictive approach. And we have increased the restrictions at the border as we loosen up domestically. We need to keep COVID-19 out to keep our domestic economy operating as freely as possible, and this is very important. We all know New Zealanders have worked hard and sacrificed a great deal to get to where we are. And I've had a number of letters from people who, particularly during that lockdown period in alert level 4, were not able to spend time with dying relatives or friends or to attend to funeral arrangements. And each of those stories is, in a way, heartbreaking. We know people have made sacrifices, and many people accepted, even if it was extremely difficult, accepted the need to do that so that we could be in the position we are today. So the information about this change to the opportunity, or in fact there being no opportunity now to attend a funeral or tangihanga when people return, that information is now available on our website, so people contemplating the move back or coming back for that purpose are aware of it before they leave where they happen to be. Returning to our numbers, today is obviously 18 days since the last new cases were reported in New Zealand, and again there are no active cases, so there will be no change to the number of confirmed cases we will be reporting to the WHO. Yesterday there were 1,053 tests processed at our laboratories. Again, the Monday number tends to be low, coming off the back of a weekend. The total number of tests to date is just under 296,000. 8 significant clusters have been closed. That's no change to yesterday, but each of those clusters that is currently what we call dormant will be closed over coming days as we get to a 28-day period of no further transmission within each of those clusters. Finally, I do want to reiterate the comments made by the Prime Minister yesterday about being prepared for additional cases in the future. We know this will happen. It may be that we detect a case at the border. We're now making sure that we detect those cases whether people have symptoms or not. We may even find cases still here in our community onshore. It's not guaranteed that there are not cases there. We should be prepared for that, and we are prepared with our ongoing testing, contact tracing, and arrangements for isolating people. So that's why we will continue the comprehensive testing regime of symptomatic people, and of course that enhanced testing at the border. And finally, the New Zealand COVID Tracer app, which we are encouraging people to continue using. We're encouraging all venues to display the relevant QR code to assist people in scanning that QR code so they can keep an easy record of where they have been. We now have 535,000 registrations, so that's 13,000 more than yesterday, and I'm pleased to see people continue to take up that option. We now have 40,703 businesses who have generated QR codes. And the information about how to do that for any business that hasn't yet but is very keen to do it, I'm sure, is on our website or on the COVID-19 website. I'm happy to take questions.
How long have you been thinking about not allowing this exemption? Is it something that was discussed before and then just action today? And also, what do you say to family members who are perhaps watching this and maybe relaying that information to to loved ones overseas? What message would you like to get to them?
Well, in answer to the first question, this has been part of our preparation for Alert Level 1, as in particular we've focused on the need to strengthen a range of measures at the border to ensure that it is, as I say, both watertight and airtight. So that relates to people coming in on ships and, of course, by air. So this is one of the important changes that we are making at the border. And what I would say to loved ones who are in this situation and have got relatives or friends coming back from overseas is there is still the opportunity to apply for that compassionate exemption to be able to spend time together. And it is around the attendance at the actual funeral or tangihanga rather than the ability to actually spend time either with a dying loved one or as part of a grieving group of people.
Why is it relevantly safer not to attend the funeral, to be excluded from the funeral than it is to attend wider, potentially looser contact traced events, like I guess weddings? I mean, what are you seeing when you look at that kind of wider group gathering?
So the distinction here is people coming in across the border who are in managed isolation won't be able to attend any event with a lot of people. So in a sense, in Alert Level 1 there are no restrictions on numbers at any gathering, including attending large sports games, concerts, because we're confident we haven't got community transmission or the disease lurking here onshore. So this is part of ensuring that we are reducing the risk to as low as possible of an imported case potentially sparking off infection here domestically. And obviously, even if someone is infective and does infect the small group they are with, it is much easier to manage that and ring fence that than it would be if there was a larger event without those physical distancing requirements.
But one can imagine a funeral has a contact trace that you fill in the register, right? But what other events are you talking about people will be allowed to attend? Is there a limit to the numbers, less than 10, more than 5, 20?
Yep. It's a small group, so I'm thinking here it's it's somewhere between 5 and 10. It's attending on probably going out for the day to spend time with a group of relatives or friends with someone who may be dying or afterwards in that grieving thing. But it's very much a small group. It's not attending the large gathering, a service, a burial ceremony and a wake or the longer tangihanga. One more question.
Sorry. So then will they have to apply, each person will have to put an application and provide a safe plan for them to be able to do that in that smaller city?
Correct, and they can initiate that application before they even travel to New Zealand. It's very important that people do understand what is expected and what the requirements are. Unfortunately, we still have people arriving who aren't aware even of what the requirements and expectations were around going into managed isolation once they arrived. So yes, people should initiate that exemption process before they come. Please.
Messaging about COVID today has changed from Unite Against COVID-19 to Unite for the Recovery. And I noticed the website has a big focus on wellbeing and quote, you're not alone, find the help that you need. So I just thought I'd ask, what issues, particularly mental health issues, which is a focus on the website as well, are New Zealanders facing right now?
So I think there is a range of issues, and I would put those broadly under, from where I sit, because I come from a health lens. So those broader determinants of health and well-being. So they are, social aspects, and that includes for individuals their mental and physical well-being, of course. On the latter, physical well-being, it may well be that there was care that they missed out on during the lockdown period, and we know district health boards are working very fast to ensure that people who missed out on either diagnostic or treatment procedures get those as soon as possible. We haven't seen at this point, and we didn't see through the lockdown, an increase in mental health issues. We saw mental health challenges for some people, and there are resources available. My view is that that people's health and well-being will be intimately tied up with our economic recovery and economic well-being, because many people will have suffered significantly economically as communities or as individuals, as family whānau and as communities, and it's very important that they reach out for help on that front, and there is a number of opportunities for them to do so, because that will be important for their own physical and mental well-being.
Thinking about mental health though, is it not right to say instead of there was not as many mental health issues that you weren't actually hearing them because there
I think that the opportunities were equal, if not more, than perhaps during normal life. Where there was obviously the helpline, the 1737 helpline, but we also stood up some additional virtual opportunities and web-based opportunities. And I know that many mental health practitioners were actually delivering consults virtually. And the feedback I've had is that many people actually found that better than face-to-face for whatever reason and want to continue that as we come out of that lockdown situation.
What advice would you give to Kiwis now that we're in level 1? Would you encourage them to let their hair down a little bit?
Yes, even have a dance if the mood takes them. Yes, look, we have done the hard mahi here, and our work has paid off. We should, and I go to those key messages on the Unite for recovery. Actually, it's about buying local, it's about getting out and about, doing things together, and it's about enjoying everything that this country has to offer. And the chance to do that with friends, with wider groups of friends and in the community, I think is wonderful, and people should take that opportunity. Notwithstanding, you know, as I've said before, there is still a pandemic raging beyond our shores, and we need to make sure we're doing everything to keep the gains we have made.
It is, of course, the first day of level 1. Did you do anything differently this morning?
No, I didn't, actually. I just got up and came to work.
On those testing numbers of people coming into New Zealand, you talked about day 3 and day 12. Why wait 3 days to test someone? Why not just do it as soon as they arrive?
Yeah, around day 3, and that is because we know that for most people, they will, if they have got, if they've been exposed and are brewing the infection, by day 5, they will they're more likely to test positive. So we're taking into account the fact that they will have taken a day or 2 to get here, and rather than testing them immediately, which might only be day 1 or day 2, if they're symptomatic recalling, then they are automatically quarantined and tested. So we think day 5, if they are brewing something, which would be about day 3 here, is the reason for that. And then day 12, more as just a clearance to make sure that they are ready. It's as a sort of belt and braces before they are allowed to go from managed isolation.
We have heard a rumour that there's a suspected case in the Auckland District Health Board region. Do you know anything about that?
Yes, I do. And I think this goes to the comment that was made by the Prime Minister yesterday, and I've made it today. Actually, we did get notified this morning of a possible positive result, and because it was a very weak positive, it was retested and revalidated. What I can say in this case is that the people who were tested did everything right in terms of calling ahead, were sent by the GP to a CBAC, they were tested, actually 2 siblings, one came back negative, one was a weak positive. Of course, that made a few hearts flutter, but the revalidation showed that it was a negative result, which is good. And again, I think this goes to 2 points I'd want to make is we have excellent testing capacity, and it is our intention to keep testing people who for whom a test is indicated, and that's how we will find any cases that might be out there. The second point is, as the Prime Minister said yesterday, we will find further cases. Finding them is a good thing, because then we have the mechanisms in place to contain and stop any further spread.
How many people can you let in through the border a day into managed isolation facilities? What's the capacity there? My understanding is it's around 250 per day?
Yeah, it's somewhere between 200 to 300, and at any point in time we have around 3,000 people in a managed isolation facility. This week we are standing up facilities in Wellington and Christchurch, so there will be some flights that will come directly to Wellington and Christchurch, so there will be additional capacity there. And one of the things we are wanting to look at with the introduction of the testing of everybody at around day 3 and day 12 is, as we get that information about what the likelihood is of someone who has a negative test at day 3 actually going on and developing, and if we find, again, depending where they have come from, if it's very low risk, we may find there's an option to release people, as it were, or allow them to go into a self-isolation situation for the second 7-day period. Collecting this information will help inform decisions there, which will again increase our capacity in those facilities.
Well, contact tracing, I just want to sort of lay out briefly a situation for you. If you and I were to go to a cafe, not knowing each other, at the same time, there's no contact tracing sort of register required, but on the cafe's part. We each return to our homes, we write down in our diaries that we went to the cafe. Later on, I test positive for COVID-19. I tell the contact tracers I was at that cafe. How do they get in contact with you if there's no central register at that cafe?
So what happens is the public health unit does a very detailed interview with the individual who's the case, and they will say at 10 o'clock on such and such a date I was at Word of Mouth Cafe, and then we can publicise that, and we can tell the cafe, it can put up notice as well, and of course we publicise that. And you saw this early on in our contact tracing efforts, where we had a few cases, we were able to say exactly the times and places that people had been. Of course, we now have the added advantage that when you and I went to that cafe, we would have pulled our cell phones out on the way in and scanned the QR code, which will keep a record on our cell phones. The next functionality that will be added in the upgrade of the COVID Tracer app, NZ COVID Tracer app, will be the ability for us to push messages out to people who were in a venue at the same time as someone who may be a case. So that is an added functionality that will be coming along, and that again will help. But that complements our already pretty robust manual process as well.
So you have confidence that waiving this requirement for businesses to have pen and paper registers or some sort of centralised register doesn't weaken our contact tracing?
No, I don't. No, what's the right answer here? Yes, I have confidence. I don't have any concerns about this. And again, I would encourage all businesses to. It's a relatively simple procedure to print off the QR code, and it just will allow people and encourage people to use the app. I'm finding it incredibly easy just to, wherever I go into somewhere, just to scan it. As here at the facility we're in here today, it's very easy. Please. So the explanation for their illness is not COVID-19, so they'll be managed by the general practitioner just for the illness, the respiratory illness they have, but there's no further monitoring required. So this does happen. We have had false positive tests before over the last few months, and that's why positives are all revalidated just to check that they are positives, especially if they're weakly positive. It's not a super exact science.
Will migrant workers be able to return to the country with their families? Currently, partners of citizens and residents can return. What about partners of migrants that are currently here?
That's one of the areas that's been looked at. I think there are several bits of work that are being looked at the moment. One is people who are usually resident in New Zealand who happen to be overseas, either themselves or they're partners of people who are here. Secondly, of course, international students is another group that we're very interested, and then there will be some other industries that might want to bring in essential workers as well. So all of those are being looked at, and the strengthened measures we have put around the border will, I think, assist with us being able to look at those and think about how people can be brought back safely.
Is there a level 0, and what will that look like for the country?
Well, first day in level 1, I think let's just settle into level 1. Level 1 looks pretty good to me at the moment, but clearly, the characteristics of level 1 are very much, we're essentially open for everything domestically with those very tight controls over the border, and that is where our efforts and our focus. Perhaps a final question?
Yeah, this is the road for the 1 p.m. stand-up where you sort of held, some national attention and it's been appointment viewing. Is there anything you sort of want to say of, I guess what the country's been through and what this is, to mark the end of the 1 p.m. stand-ups?
Well, the first thing I would say is I hope this is the last 1 p.m. stand-up, not because I haven't enjoyed them, but because there is still a long way to go on this journey, and it may well be that we get cases and we need to restart briefings. But for the time being, I think I hope they've served their purpose well to keep everybody informed. The only other comment I will make, and I've done it again, and I'm not being gratuitous here, but it wouldn't have worked if you hadn't come along and played your bit, both in passing the message through to New Zealanders very effectively, but also in asking the questions that need to be asked to make sure that our response was the best it could be, and that we were being accountable for delivering the response that we needed. There is a final question over here. Actually, there are two more, please.
Sorry, just one quick question. Nick Wilson was on Morning Report this morning. He was fairly scathing, I guess, about the contact described as completely unacceptable. He says he describes the act as low quality. What's your response to that?
Well, he's been quite restrained for Nick, I would have thought. Look, I think we've found right through this, we've had a range of informed and helpful views and occasionally criticisms, and that's fine. We're happy to provide a different view. But one thing I think that has characterised our response here in New Zealand is that, as people have seen, the contest has been around the evidence and the science, not around the politics of the response, and I think that has served us well. We will continue to look to Nick, Michael Baker and many others who will look at the evidence of what's happening overseas. They will continue to opine on our response here, and I welcome that. We'll keep working with them.
Just what are you going to do with your new public profile? You know, there's artwork in Te Papa, the beard your face now. What are the people who've seen you every day who want to keep seeing you?
Well, they could go to Te Papa, I guess. Look, I just want to say I've been doing my job. It's a great privilege to be doing it, and we've got a whole health system that I work with many good people on helping to ensure delivers for New Zealand, and that's where our focus will stay. So life goes on, and we're not over this. A big part of our response is maintaining our ability to respond to the COVID-19 global pandemic, and that's an ongoing effort. Thank you very much. I really appreciate your support. Cheerio.
You cannot appear shocked. My children